Our guest on this episode is a longtime listener of this podcast and has been a part of my network for several years. We recently met in person for the very first time and had a chance to chat face to face. She's an elected member, recently elected to the New Hampshire House of Representatives. She ran on the firm belief that a healthy economy, healthy community, and healthy climate can coexist. I'm excited for you to get to know her through our conversation on this episode. You're listening to the PHEC podcast, episode 388. The field of public health is so broad, overlapping multiple industries. With epidemiology at the core of public health, there are an unlimited number of ways to target specific populations, health conditions, environmental issues, and causes that matter most to you. My name is Dr. Huntley, and I'm the host here on the Public Health Epidemiology Conversations podcast. I'm an epidemiologist, consultant, and entrepreneur with over 20 years of experience in healthcare and public health. On this podcast, my guests and I engage in conversations that demonstrate the importance of public health and epidemiology across a variety of industries, helping you think outside the box and inspire greater positive impact in communities around the world. Now, let's dive into the topic of this brand new episode. Greetings, everyone, and thank you for joining me on this episode. My name is Dr. Charlotte Huntley, and I lead an epidemiology consulting firm that supports large nonprofit organizations and government agencies that serve Black, Indigenous, and people of color communities, commonly referred to as BIPOC communities. We are often invited to support tribal organizations, and we're always honored to serve. We help our clients collect, analyze, manage, and communicate their data and health information in plain language to the communities they serve. If your organization serves BIPOC communities or is genuinely interested in building relationships with BIPOC communities, then please reach out to us and let us know how we can help you. You can reach us at DrCHHuntley.com. We'd be happy to meet with you and explore how we might be able to support your organization. Links are also provided on the show notes page and in the description for this podcast episode. I am excited to introduce you to the guest that we have on this episode. She's a longtime listener of this podcast and has been a part of my network for several years. We recently met in person for the first time and finally had the opportunity to have a real face-to-face conversation. That's always such a treat when you engage with someone in a virtual setting online, through emails, and then you finally get a chance to meet with them in person, face-to-face. It really does elevate the relationship, and it's really exciting. So let me formally introduce her to you, and then I'll connect our conversation. Dr. Jennier Mandelbaum was elected to the New Hampshire House of Representatives in a March 2024 special election. She ran on the firm belief that a healthy economy, healthy community, and healthy climate can coexist. With a diverse background spanning academia, government, and industry, she specializes in chronic disease prevention, mixed methods research, and the social determinants of health. In her day job, she works at Athena Health, a Boston-based health tech company, leading survey and qualitative research examining unique insights and emerging trends within the healthcare landscape. Her contributions to public health have earned her accolades, including the 2022 Rising Star Award from the National Association of Chronic Disease Directors and the 2023 Early Career Award from the American Public Health Association's Public Health Education and Health Promotion section. Locally, she serves as a trustee of the Portsmouth, New Hampshire Public Library, while nationally, she is an active member of the American Public Health Association's Education Board and Health Policy Ambassador for the Society of Behavioral Medicine. Dr. Mandelbaum holds a bachelor's from Bredes University, a master's of public health from Yale University, and a PhD in health behavior from the University of South Carolina. In recognition of her leadership, she was named to Seacoast 10 to watch in the Boston Congress of Public Health 40 Under 40 in 2023. And is a member of the New Hampshire Union Leaders 40 Under 40 class of 2024. Let's connect my conversation with Dr. Mandelbaum right now. Hi, Jennifer. Welcome to the podcast. How are you?
Hi, thanks for having me. I've been a long time listener, so I'm very excited to be a guest.
Oh, that makes me really happy. I remember, I guess you were a student and you were at the University of South Carolina, I think, when we first kind of crossed paths online. So for a while, I just assumed you were, from South Carolina. And then a little later, I'm thinking, what is she doing in New Hampshire?
Yeah, I'm originally from New Hampshire and moved to South Carolina to attend the University of South Carolina for my doctorate. And then I'm not sure where I would have wound up without the pandemic, but when the pandemic hit, I went home for a little bit and just ended up staying.
Nice, nice. Well, why don't we kick off by you officially introducing yourself? Tell everyone a little bit about who you are and then we'll continue our conversation.
Yeah, absolutely. So I like to say that I'm a public health scientist, educator, and policymaker. So my background is in social and behavioral sciences. In my day job, I work for Athena Health, which is a health tech company, kind of in a unique role. I'm one of two researchers in our organization, and we study emerging trends and insights in the healthcare landscape. And it just makes me think of this quote that I want to attribute to Dr. Sandro Galea, but I'm not quite sure. But something about how fortunate we are to be able to be paid to think and to write. And that's what I get to do and really enjoy that. I also knew that I didn't want to fully give up academia when I graduated. So I was looking for part-time or adjunct positions when I was finishing up my PhD and stumbled upon this ad from Tufts University in Medford, Massachusetts. And so now I teach an intro to community health class. And that's mostly for freshmen and sophomores. And they're just so bright eyed and not jaded about the world. It's amazing. And I find that it connects me to public health in just a different way than my day job does. And then lastly, I was elected to the New Hampshire House of Representatives in March of this year and was just reelected for my first full 2-year term. I know we'll get into that a little bit, but that was kind of an unexpected turn in my professional journey.
Oh my gosh. Yes. Thank you for that introduction. I love the dynamic and I also relate to wanting, that foot in the academic world kind of brings a different perspective. And I did that for several years, kind of for that reason. There's something about that connection, that perspective is different, but also complements the actual work
Yeah.
that you're doing in your other role. And yeah, I do have a lot of questions about that advocacy part. So
Mhm.
thank
Ask
you for
away.
that great introduction. And you immediately, it's like you graduated and you put on all the hats. It's like, I'm just going to take off and do this.
All right. So many hats.
Yeah, that is perfectly great. That's great. This is one of my favorite questions. And you're a longtime listener to the podcast. So did you find the podcast when you were working on your doctorate? Is that the time that you stumbled on it?
I want to say it was when I started working for the South Carolina Department of Public Health.
Okay.
So was the podcast on back in 2019?
Yeah. Yeah. We actually started in 2017
All right. I think
and
that was it. I
run.
have this vague memory of driving to the office and hearing your voice.
That's interesting too, because well, of course, I had already left working for the state by the time
Mhm.
you started working there, but that's another kind of crossover in our paths. That's really interesting. So, my question I was going to ask you though, when did you first learn about public health or become interested in public health as a career?
Yeah. So I grew up in a household where health and healthcare was dinner table conversation. So my dad and brother have chronic health conditions, and both my parents worked within healthcare. My dad in policy and management, and my mom is a psychotherapist. So definitely got a lot of different perspectives there. And I grew up thinking, I'm going to be an endocrinologist and I'm going to find a cure for type 1 diabetes. That's what my dad has. And I got to college and was like, I'm not sure I want to do clinical care, but I want to do something within healthcare, but I don't really know what's out there unless it's kind of the business side of things. And then I took this class called American Healthcare that was taught by Dr. Stuart Altman, who was very involved with the Clinton administration's healthcare reform efforts in the 90s. And this was in 2010 when the Affordable Care Act passed, and we were thinking a lot about when different parts of the legislation would take effect and kind of what does this mean for the US healthcare system. This is really the most substantial piece of healthcare reform since Medicare and Medicaid. So it was just an interesting time to be kind of studying things related to health. And it was in that class where I first heard the term public health. And it was a real light bulb moment for me. I just really fell in love with the idea of potentially affecting change at a population level, thinking about groups of people. It's certainly not a knock against kind of more clinical one-on-one care. But I think for me, it was just appealing to think about these larger structural forces and how they affect people's health and well-being. So that was kind of the spark.
Nice. I think it's, as I'm even hearing you explain that and learning about you, I can see where like the seeds of public health and what you're doing now is kind of planted a long time ago, like through your family and the path is interesting, I think. So is there a particular population or issue or condition that you're most passionate about now?
Yeah. So I've done a fair amount of work around child and adolescent health. And I think if I were to choose one kind of population, of interest, that would be it. I did a lot of work with the University of South Carolina Smart State Center for Healthcare Quality around adolescent nutrition counseling and the extent to which pediatric primary care providers in South Carolina are providing this recommended nutrition counseling at well child visits. And spoiler alert, it is a very small percentage of them. But that was also my first time using electronic health records to do data analysis. And that's been a nice tie-in to my current role. I'm also very involved with the Society of Behavioral Medicine, and I'm one of their child nutrition ambassadors. So I work with our federal delegation to talk about legislation that might affect children's nutrition behaviors or access, anything that might be related to the Farm Bill or, new school lunch requirements and things like that. And then kind of in general interested in chronic disease prevention and management. So, how can we kind of address things earlier on in kind of that disease pathway? And, how can we both instill healthy habits in people and also address some of those parts of the social ecological model that are a bit more kind of, community-based factors or at the policy level. I've got the social ecological model on my mind these days. It's a big part of the class I teach at Tufts.
Nice. So thank you for that too. You see me scribbling down with my notes. I am curious now to know a little bit more about like your current role, because you say, that introduction to working with electronic health records has kind of prepared you for what you're doing now. And I'm always intrigued when we found this intersection of healthcare and public health, which is where my backgrounds come together, working in healthcare for a good, I want to say a handful of years, which is a very Southern phrase to use, right? But, I often think that's a very strong, when you have those overlapping interests or backgrounds or expertise, that's a very strong point of positioning. So tell us a little bit more about your current role.
Yeah, so I am the mixed methods research manager at Athena Health, which is a health tech company based in Boston. And our primary product is an electronic health record system. We are, I believe, the second leading provider of EHRs in the US, and we focus mostly on ambulatory care practices. So maybe, you're a primary care physician or pediatrician or dermatologist, those kind of smaller to medium-sized practices. And I work on the research side, and I lead surveys and interview and focus group work to get a better understanding of what our customers are thinking about our products in the larger healthcare landscape, and also what trends that we see emerging within the field as a whole. So we put out this annual physician sentiment survey that's a nationwide, nationally representative survey of physicians. And they're not necessarily physicians who are part of our network, but we ask a really wide array of questions around things like burnout, what they think would make the healthcare system more cost efficient or provide higher quality patient care. We have a lot of questions in the upcoming survey about artificial intelligence. And I think where kind of that EHR overlap comes in is not only in kind of the work we do around our products, but also in that my colleague, who's the quantitative research manager, she directly pulls information from our EHR. So we have anonymized patient data that we can do some really neat analyses with.
Nice. Wow. That is interesting work. So the report that you put out, is that just an internal that gets circulated to internally within your organization, or does that go out to the participants, or like how spread is that dissemination?
Yeah, I can share some links with you afterward, but we
Oh,
do put out blog posts and press releases and articles on our website that do talk about some of the findings. So we recently published some work on our website, but it's available to anyone who searches for it around value-based care, what physicians are thinking about artificial intelligence, and we have some upcoming work around maternal mental health and patient digital engagement. So kind of a wide variety of topics, which is something
yeah.
I also really enjoy about my work, that we get to kind of explore so many different areas.
Well, that is really nice too, because, you know, as a researcher, you want your dissemination is always an important part of that. You don't want it just sitting on like a library shelf, air quotes
Yes.
library, what that looks like
Um,
these days. But, you know, be able to sharing that across different platforms. It's nice to be able to put that into the hands of people that can get the information and then, you know, decide what they need to do with it.
Absolutely. And that was a big part of my role at the Department of Public Health, where my official title was program evaluator, but I led our data dissemination initiative. So we were also finding that, the information we collected would get compiled into a report that we'd send off to the CDC, which funded our work. And that was it. We weren't necessarily communicating those findings back to the communities where we got that information from. I think we're doing some really nice work that we ended up publishing in a few peer-reviewed journals and presenting at conferences. And I think just kind of a personal grudge isn't quite the right word, but South Carolina doesn't necessarily score high in a lot of health indicators. And I don't think that's for lack of trying by the people who are, on the ground doing the work. So I kind of felt this pull to make sure that we were sharing some of the work that we were doing, because I think sometimes it was in very small ways, but we were, and I think, the state still is moving the needle. And I wanted people outside of South Carolina to know that.
Yeah, that's great. Well, I think that this is also a great time to kind of segue into that advocacy work too, because I'm probably going to come back to some of this community-based work. And what I'm thinking is, just the nature of where we are in the US, especially with shifting administrations. We just had, the time we're recording this is just had a, recent presidential election where it was a very close race. So we know half of folks are feeling some kind of way in an extreme. The other half are the opposite. And we're trying to, at the time that this episode will be published, we'll be in the middle of that transition of power, so to speak. And there's just all the feelings, all the thoughts, the worries, all the things that are floating around with people, especially as it relates to health, with health being the focus and the concern. And as we talk about, even down to some of the things that you were just mentioning, how we are sharing that information with communities and valuing science and communicating and prevention, chronic disease prevention. All of these things are very vulnerable topics, and where we go is just in sort of a limbo state or unsure state, I guess, for a lot of people. And some people that I speak to are, all the feelings, frustrated, helpless, not knowing what to do next or if they could do anything that would matter. So as I'm thinking about all of these in my mind, and thinking about kind of as we're talking about your journey and building up, I want to talk a bit about this political role, and how did you even get there? So start by explaining again what you do, and then how did you get there?
Sure. So I am a member of the New Hampshire House of Representatives. I was elected in a special election in March of this year and then was reelected to my first full 2-year term on our national election day in November. And the New Hampshire House is kind of quirky in a few different ways. And one of them is that we have 400 representatives. I think Pennsylvania has the next most with 200 and something, and we're only slightly smaller than the US House of Representatives. So definitely unique in that regard. And we are a part-time legislature. So we meet once a week from January through June. Those are our session days. And then nearly everyone is assigned to a committee. And those committees, kind of the time commitment can vary. Between March and June, I only met with my committee once, but there are other committees like criminal justice or education or health and human services that sometimes meet multiple times a week. So it's one of those things where it can take up as much time as you want to give it, but there are also some options for folks who don't necessarily have the time or flexibility to, be up at the State House 4 days a week.
Right.
Kind of how that all came about was that I had collaborated with a nonprofit group in New Hampshire called 603 Forward last summer, so summer 2023, around the housing shortage on New Hampshire's seacoast. And I think there's kind of the housing shortage throughout the country. We definitely feel it in New Hampshire too, where, it's just really hard for young people and young families to be able to afford to live here. And they just keep getting priced out. So we just gathered a small group, talked about that, some of the challenges, and we had a city councilor join us to talk about what the city is doing to ease some of those regulations to make it easier to build housing. And so I had just kind of kept in touch with 603 Forward over the next few months. And then I get this vague email, and it's like, can you talk later today? So I get on this phone call a couple hours later and learn that my representative was moving out of the district. So he had resigned his seat. And so now there was this open seat, and I was asked if I was interested. And I was like, yeah, I'll think about that. And their response was, no, we need to know like now so we can tell the party we have someone. And I think my exact response was something like, sure, I'll give it a go. So I don't quite have a life plan, but it was definitely not part of that. An unexpected pivot, but just thought I'd try it out and see how it goes. It just wasn't ever something I imagined I would do.
Wow. I talk to a lot of folks who describe something similar where they'll say, you just have to jump in. Sometimes you just have to jump in. When the opportunity, is in front of you, you are obviously qualified if someone is inviting you and asking you to consider the role and they saw something in you. So sometimes you have to kind of trust that and be willing to, figure it out in real time, right? Mm-hmm. Figure it out as you go, so to speak. Learn on the go. I love that. That takes courage. So I like that you had the courage to give it a go. And what did you learn? I guess it must have been a great experience for you to, put your name out there for election time, official time around. So what was that like for you to decide, okay, well, yeah, I want to do more of this?
Yeah. I mean, it's kind of a trial by fire. When I first started, because I joined in March, I didn't get a chance to, be part of any bills and wasn't too familiar with how the process worked in the State House. And then once I felt like I did understand how things worked, we had crossover. So where House bills go to the Senate and Senate bills come to the House. And that threw me for a loop. So it was definitely a steep learning curve. And I left that very short, biennial term thinking I'd like to do more of this. I think I have, expertise to add as someone in public health, and also liked the people I was working with on, both sides of the aisle. I think, I think it sounds a little cliche to say no matter your viewpoints, we all just want what's best for our communities, and that can be different, and that's okay. But there are just a lot of, hardworking, caring people there.
That's really good. You and I were talking a little bit about bipartisan relationships and what does that mean? I think this can be a refreshing perspective given kind of where we are in our times now. And I was also explaining, I've had this conversation a few times because I know that there are a lot of people who feel a little like up in the air. I don't know. Some people are just tired. Like, okay, I've done all this work. My candidate did not win. I'm just tired of this and I don't know what's going to happen. And legitimately so, there's a lot of concern about what's going to happen with health, right? Certain communities, Black BIPOC communities, are more concerned and feeling really worn out. And then there are people who feel, well, I'm going to try anyway because, like you said, sometimes it does resonate with us. Like we can believe in the sense that no matter what political party you are a part of, at the end of the day, we really do want what's best for, and insert the topic. In this case, we're going to say health. And then at the core, a lot of us believe that, but then we see these extreme cases where we wonder, is that really truly it? So let's talk a little bit more about, this bipartisan relationship, like from your experience. What is that really like as if you're going in with Democratic views and you're going to talk to a room of Republicans? What is that really like in terms of, a bipartisan led or themed conversation?
Yeah. So I really believe that bipartisanship is the best way to get things done, that, compromise and conversation are really necessary to enact legislation that's going to be sustainable. So rather than one side passing something when they're in power and then when the other side is in power, essentially kind of, undoing the work of the other side, I think kind of that compromise helps to ensure that a policy is going to stay in place for longer. Whether, you think it's good or bad policy or not. And then from a practical level too, I am now in the minority party in the House. Last term, it was very close and in some ways felt a little bit like a numbers game where sometimes we would table bills. So tabling is when we say like, we might come back to this bill. Sometimes it's a kind way to kill a bill and sometimes it's a way to come back to a bill later. And then throughout the day, as some people, leave for other commitments, then if it seems like your side might have numbers to pass this very partisan bill, then someone would vote to remove it from the table and we'd vote on it. So it kind of felt like a game to me. And I don't think that's the way good policy should be passed. I felt like there were a lot of like very partisan bills. And now being in the minority, I think there's also a realization that, if we want some of our side's priorities to pass, we need to be working with the other side. And I also kind of take this perspective where, I'm a registered Democrat. Those ideals tend to line up more with my beliefs, but I don't see any problem working with Republicans. I think sometimes we get so entrenched in like this party warfare and tribalism, and I don't think that's helpful. You can vehemently disagree with someone on a whole slew of topics, but maybe you find something that you do agree on that you want to see. So about half of the legislation I'm co-sponsoring for this upcoming year was put forth by Republicans. And a lot of them are healthcare related. And I think that just speaks to, ways that we can find, common areas of interest, that good ideas can come from whichever side of the aisle you're on. And that I feel like party should be one of the least important considerations when you are putting forth or voting on legislation.
Okay. I'm going to try to play the role of some of my listeners.
Yeah.
So, and you and I talked about this a little bit too, and I love everything that you're saying. And now I'm going to roll it down to more of a level that's a little bit more relatable for most of the people listening. How can our listeners, thinking about where they may be, you've been a listener to the podcast, we have a mixture of folks. We have students, we have career professionals from early to senior. We've got people in a variety of roles. And how can, a couple of parts to this question, right? What are some things that people can do like right where they are if they don't want to step into an actual political role, but they want to be able to feel like they're making a difference? Like, what are some things that, they can do? I'll start with that question first.
Yeah. So, I mean, I totally hear what you were saying a few minutes ago about people having a lot of big emotion around the November election and whether you're pleased or disappointed in the results at both kind of the national and the state level. Just want to kind of validate those feelings. On kind of a local level, I think there are a number of ways that people can be civically engaged, and it just kind of depends on the resources you have or want to give. So it can really be as simple as talking to your neighbor about something that is important to you. You could write a letter to the editor for your local paper. You can make phone calls to your representatives about an issue that's important to you. You can, arrange to meet with some of their local staffers. Our federal representatives have local offices throughout the state. You can join a board. So I'm on the board of our public library in town and find that that's a great way to better understand and promote the resources of the library. You can, volunteer somewhere for a cause that's important to you. You can run for elected positions that might be a little bit kind of local and more personal. So that could be something like your local school board. You can volunteer with the PTA. I think there's so many ways to get involved. And I think any kind of civic engagement like that helps people feel more connected to their communities, like they have a greater stake in what happens. And you might even see some progress based on what you do.
Yeah. Those are some great tips too. I actually wrote down the local board and the library. I never thought about that one, but that's just a personal note for myself though, because my grandson loves going to the library. He's 3 years old and he can't read yet, but he loves going to the library. So
library so much. There's such great resources and offer so much for nothing. It's free. Take advantage of that.
So that you gave me some good reminders in your examples. Also, couple years back, I did join a call with our federal representatives with his local folks over an issue with someone else invited me to join. And I had the initial thought, well, he's not going to care about what our views are. And I almost didn't do it, but I'm glad that I did. It was actually a very good conversation. I don't know what really happened after that. It was a topic that they were much more passionate about, and I was really more supporting them with the call. But I've thought about maybe revisiting some of that for myself on something that I am, more driven to, want to discuss or talk about or advocate for. So I love your examples and your ideas. What about, here's the other part of the question that I didn't want to combine because I felt it was too much for one. But what if someone is actually feeling like some bit of spark, like I want to step into doing something? How does someone get involved or go to create a path if they want to maybe submit their name to be on a ballot at some point?
Yeah, so I think it looks different for everyone. It was interesting for me because someone reached out to me about joining. But I think if you're interested, you can start by potentially reaching out to your local political party. They can offer a lot of resources if you're, interested in running, or kind of give you a sense of like what the local political scene is. There are also a number of organizations that I've had support from, like Run for Something. There's in New Hampshire, we have a New Hampshire Young Democrats organization. So I think kind of tapping into these larger groups like Run for Something and some of the more local ones that can give you advice around like what it means to run a campaign and really break down those different steps so that it doesn't feel so overwhelming. But I mean, to anyone interested, I mean, it's a big decision, so I'm not going to just say go for it. There's a lot to think about. And, in New Hampshire, I mean, I had to think about like, can I take basically like, be out of office for one day a week? And I'm fortunate to have a boss who is really supportive of what I do at the State House. And I bring my laptop to the House floor and get work done in between votes. But that's a challenge. And if you have kids, that can be challenging too. And we get paid $100 a year. So there's like no financial incentive to do this. So all of that varies by state, but certainly that's kind of the logistics of it are something to think seriously about. But I think if you really want to do it, I'd encourage you to look into some of those resources I mentioned, to read about some of the issues that have been going on in your community that you'd like to be part of. I mean, maybe that spark that you feel is about, a challenge in your community that you don't feel is being addressed adequately. And I think it kind of, in this conversation about like what went well or what went wrong with the November election and, potential motivation for running, just gets me thinking too about the role of our elected officials, and they are there to represent us. And if they're not doing that, you can vote them out. You just need
Yeah.
a candidate. And so if anyone wants to reach out to me, I'm happy to chat. I think, yeah, again, I'm not going to just say like, go for it, because
Right.
there's a lot to consider. But I think if you're interested, it is absolutely worth looking into, at least.
Mm-hmm. Well, thank you for that. I know we were talking about there's so many things that people can do. Like especially right now, to my people who feel tired, like I'm not doing anything. I'm just done. I've done all, I've said everything I need to say, and it doesn't matter now. It hasn't been heard. I understand the feelings, but I think that for people that are just tired and needing a break, that's perfectly fine. Do what you need to, like, prioritize that in this time. I think it's important to rest and recuperate and rebuild yourself, right? And I think that even showing support in this time, you can donate to causes that you care about, or you think voices that you think are people that are taking the action, or organizations that are taking the action that is aligned with what you believe in and what you care about. Like, your donation can help fuel them while you're resting in this, in this season. And that's a great way to support.
Absolutely. And that can make you feel better too, like you're doing something. There's this great episode of the Vox podcast, Today Explained, that was about volunteering. And it followed this young woman who kind of gave up on volunteering and was like, you know what, my small efforts aren't making a difference. And the episode is kind of about her return to volunteering and how you can make small changes, and you're going to feel better knowing that you did something. But I also totally hear your point about resting and recharging and figuring out what's important to you. Maybe the ways that you've been more civically engaged before won't work for you kind of in this next political cycle, or in this stage of your life. And so I think, however you end up showing up in your community, I think is important. And that can be, weeks or months from now.
Yeah. Well, Jennifer, thank you so much. I really enjoyed our conversation. I'm a little selfish because I had stuff I wanted to chat with you about. And I'm just letting everybody else hear our conversation. I admire you stepping up and doing what you do. That takes a lot of courage. So I thank you for having the courage to say yes and to be open to that, and to continue to do what you do. I mean, you are inspiring people, and you probably you may not be aware of it, but, showing up how you feel, led to do so is really important. So thank you for the time and answering all my questions and engaging in conversation with me and sharing on this podcast. And thank you for listening to this podcast. So I just appreciate you.
Thank you for inviting me. This was a dream. And yeah, I mean, I hope some of what I said was useful, and, if that it inspires anyone to get more involved, that's amazing. And just really enjoyed speaking with you.
Oh, it's been great. So next time you're in South Carolina, I'm going to take you to lunch.
Oh, thank you.
All right, Jennifer, I'll be in touch.
All right. Thanks, Dr. Huntley.
I really hope you enjoyed that conversation as much as we did. Dr. Mandelbaum is a true leader and is having a big positive impact on the communities that she serves. I encourage you to connect with her and learn more about her work and all the amazing things that she's doing. The show notes page for this episode, which is 388, can be found at phecpodcast.com. Once you're there, just navigate to episode 388 to find the show notes. One more thing before we go. Please take a moment and share this episode with a friend. I'm sure you know someone who would really be interested in hearing this conversation with so many rich insights that we shared on this episode. If you're listening right now in one of the podcast apps, you can easily share this episode through text or directly to social media. If you're at the bottom of our show notes page, you'll find social sharing buttons, which makes it so much easier for you to share this episode with your network. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening to the Public Health Epidemiology Conversations podcast. Visit phecpodcast.com to find the show notes for each episode and to learn how to work with me.